Millions of people are traveling for Thanksgiving despite government officials urging them to stay home amid fears with cases skyrocketing nationwide. The healthcare system could be overwhelmed in the next 2 weeks, experts say. Dr. Marty Makary is a physician and professor of public health at Johns Hopkins and a Fox News contributor. Dr. Makary, great to see you. Dr. Krutika Kupali, she's an infectious disease researcher at the Medical University of South Carolina, says, and I'm quoting, "I'm a little bit concerned we might start seeing things on a scale of what we saw earlier this year in places like China and Spain and Italy." Could things get that bad following Thanksgiving, do you believe?
Well, look, I think we're going to see a series of rolling increases. The trend is not a good trend. I don't think we have to worry about a mass spike with rationing at the doorsteps of our hospitals like we were concerned about back during the days of New York in March and April. But look, people need to take this thing very seriously. 90,000 Americans right now, today, Julie, are in a hospital because they are having trouble breathing or are in very serious condition because of COVID. So we're adding, as you said, about 170,000 new cases a day, but we're only diagnosing about 1 in 5 to 1 in 10. That's about 1 million new infections per day. So people do need to take precautions.
You know, the lines at COVID test sites are also increasingly long, and it takes longer now for lab results to come back. You know, the Quest tests that people used to get back in about 2 to 3 days and are now taking up to 5. And that certainly is going to complicate things as we see rates of cases skyrocket. The delays in getting those results back is also an issue. How much should people heed this warning then to stay home, considering if you are exposed, your test results are now delayed the same way they were back in the spring of 2020?
Well, I think everybody, Julie, needs to assess their own personal risk. We knew that this infection had its death or mortality skewed towards comorbidity, but we didn't realize just how skewed it was. And in fact, when we talk about those with advanced stage being at increased risk, it's really because advanced stage is linear or collinear with comorbidity. So look, testing is strained, but we don't want to be requiring every basketball player to have 2 tests in order to play. Those are the lifestyle testing things that are clogging up the system right now.
Yeah, there's a lot of companies actually that are testing employees 3 times a week. My own sister actually gets a test 3 times a week, and I know several others in the production business that are having this. My question is, you know, might we be seeing these same holiday-driven spikes in December and into January? This may be just the beginning. I mean, people are coming up are going to be celebrating Christmas, Hanukkah, Kwanzaa, New Year's, and it rolls out. And that vaccine, by the way, that the president has said the warp speed vaccine is supposed to be coming out sometime possibly by the new year. And some experts have said this could be wiped out by May. Does any of this seem realistic to you?
Well, first of all, I think it's important not to have one single blanket recommendation for Thanksgiving or Christmas. Our concern is when people are not taking precautions and they're high risk. Look, when we were telling people as a medical community to wash their hands like crazy, we probably should have been telling them to wear masks. When we told people to stay at home, we probably should have said to be outdoors and avoid indoor congregate settings. So our strategy needs to evolve. We're likely to see increases in people that are sort of in denial, maybe because of the mixed messaging and the delayed clinical science. But I think people need to assess their own individual risk. And the vaccine is very good news. Look, we were told it's 95% effective in preventing the infection, but what people don't realize is so far the vaccine phase 3 trials are showing that they are 100% effective in preventing death from COVID. That's good news, and I think we're on track for March, April, and May to be the months of mass vaccination in the United States.
Let's hope so. Dr. Marty Makary, thank you very much. Leland.